No more colorectum cancer. The colorectum is what we usually call the large intestine. It is the final recycling station of the human digestive system. Food residues complete the final absorption of nutrients here and are converted into feces and excreted from the body. Colorectal cancer, as the name suggests, is a cancer that occurs in the colon or rectum. Rectal cancer is more common and is most common in older people, especially older men. Colorectal cancer is one of the most common cancers in Taiwan. It has ranked first among the top 10 cancers for more than 10 years. Anyone can suffer from it. Generally speaking, colorectal cancer has almost no obvious symptoms in the early stages, but it can be diagnosed through regular screening. With early detection and early treatment, according to statistics, if early-stage colorectal cancer is properly treated, the survival rate is as high as over 90%. Before screening, you can first determine whether there are any abnormal or suspected symptoms, such as mild abdominal pain, bloating, sometimes frequent diarrhea, weight loss, anemia, etc., and then decide what preventive and treatment measures to take. 7 common symptoms. 1. Changes in defecation habits. If changes in defecation habits last for more than 2 weeks, such as intermittent constipation or diarrhea, stools as thin as pencils, etc., you should seek medical examination to understand the cause. 2. Bloody and mucousy stools. Generally, hemorrhoids are gastrointestinal bleeding or bright red. If dark red appears, it may be tumor bleeding. However, the amount of bleeding is not large, which is obviously different from the blood spurting out from an anal fissure. Generally speaking, if you have bleeding, you should go to the hospital for examination. 3. Irregular abdominal pain or colic. The main cause of abdominal pain or colic is intestinal obstruction causing abdominal distension, excessive gas, and excessive farts. Usually, abdominal pain symptoms can be relieved after exhaust and defecation, but it will happen repeatedly. 4. Unexplained gradual weight loss. Without deliberate weight loss, sometimes you feel poor or no appetite, and then find that your weight continues to decrease. It may be caused by the rapid expansion of cancer cells and the absorption of most of the body's nutrients. 5. Frequent abdominal distension and constipation. If you have persistent constipation or diarrhea caused by unknown reasons other than drugs or infection, you should seek medical examination to understand the cause. 6. Tenesmus inability to defecate completely. Most colorectal cancers occur in the rectum, close to the anus. Patients often feel tenesmus, heavy stool in the buttocks, always wanting to defecate all day long, and still feel that they cannot defecate completely. 7. Unexplained anemia. The tumor has already been bleeding, and if it continues to be lost bit by bit every day without knowing it, symptoms of iron deficiency anemia may appear.